Dear friends, dear colleagues from all over the world, my name is Myroslav Solonko and it is my big pleasure and honor to present in front of you today at the ITI 2021 World Symposium Online. The title of my presentation is Periodontally Oriented Philosophy of Dental Implant Rehabilitation. Think about this fact. Around 15 million dental implants are placed every year by the clinicians. Around 15 million times a year, the dentists from all over the world are trying to reproduce the nature, imitating, as you may see in this particular clinical case, the ideal position of the lost tooth, its emergence profile, and finally, the clinical crown. Dental implants are considered safe and reliable treatment option with high survival rates in the long run. Indeed, they are preferred treatment option for the patients, especially when considering multiple missing teeth and edentulous jaws. In fact, the implants are so widespread that they are even considered the tertiary dentition, which is a logical consequence of losing deciduous and permanent teeth. But we are still not perfect in imitating the nature. Due to the widespread use of dental implants and rather high rates of biological complications, peri-implant diseases, namely peri-implant mucositis and peri-implantitis, are becoming not only the dental problem, but also an emerging healthcare issue. According to various authors, the mean prevalence of peri-implantitis may reach up to 34%. We will not be mistaken if we say that in the long run, about 30% of implants will fail due to peri-implantitis. In other words, out of 15 million implants that are placed each year, 3 million will sooner or later be lost due to peri-implantitis. Therefore, we desperately need to find a way of preventing these problems. And if you look at the patient perception of peri-implantitis, which has not been widely researched yet, we may assume the outcome of peri-implant diseases may reduce the level of patient satisfaction with implant therapy.